Doctor, you mentioned using the best of both worlds, and that's combining Eastern and Western medicine. What are some of the most important things that Eastern medicine has taught us?
So you've been on my website.
I have.
You've been on my website.
Mm-hmm.
You know, I've always believed that, you know, I'm a traditionally trained MD.
Mm-hmm.
I'm an internist and been in clinical practice for over 25 years now. There's no question that there is a role for both modalities. When, you know, give you an example. I have a patient, and I've had numerous patients in the hospital that come in with a fever of 102, 103. They've got a pneumonia.
Mm-hmm.
I am not going to send them home on echinacea, golden seal, and a probiotic. I'm going to put them in the hospital. I'm going to give them intravenous antibiotics. But while they're in the hospital, I will give them intravenous antibiotics, but I will also make sure that I give them a probiotic. I'll make sure I give them a multivitamin, and I'll make sure I give them some B vitamins, because their oxidative stress, their oxidative damage is so incredibly devastating. Their body is going through so much damage. We need the multi, we need the B complex, we need other nutrients. Of course, we need the probiotic because they're on antibiotics or the good bacteria. And my residents, you know, I'm on the teaching faculty at 2 hospitals in New Jersey. My residents know that when they put somebody on an antibiotic, they better have them